comedies of the last 20 years is probably Zoolander, and one of the reasons is it uses a comedic trick of presenting absurdity as a mechanism for communicating its comedy, and absurdity seemed like a good theme to talk about this week, given what we're seeing. Obviously, we're seeing decreased case counts across just about the entire country now, which is great, and decreased hospitalizations. Although I will remind everybody that as a country, we are still above the highest case count we had ever seen in any previous wave in terms of our 7-day rolling average of cases. So we're hardly out of the woods, and yet this exuberance now is building for removing any of the vestiges of non-pharmaceutical interventions that we had maintained in place. And for most places, it was pretty minimal, to be honest. So we had already adopted the mostly let her rip strategy. There were a few places that maintained face mask mandates or implemented them, and certainly in schools. But now, as you see, all of these governors and states are announcing that mask mandates are going to go away in schools. Now, if you read the fine print, these announcements were forecasting those mandates going away in March. In a couple of these, I think in 3 of the states, it's actually the very end of March. So they're giving themselves a good 7 weeks of lead time to make this decision, which means that potentially they could roll them back if things don't go the way we hope they do. Nevertheless, the headlines are mask mandates are going away. And so what we're going to see is a building call for all of the face mask mandates and other interventions to go away, and essentially, again, remove any of the final NPIs that we had in place to slow transmission down. Now this is, out of order. This is in the context of the recent MMWR report that just came out a couple of days ago, looking at the utility of face masks. And so you see, we have all of these crazy claims by people who are supposed experts in epidemiology, saying that there's flawed evidence for masks in schools. Well, there aren't very good studies that have been able to do case control, or what you'd like to do is randomized controlled studies of schools and school districts implementing masks and then actually counting the number of students who become infected. But as we've talked about, we don't count cases in kids very well. And so we don't have great data, but we do have good data that masks actually work. And so this was a study from California looking at positive COVID results in a case cohort, and then comparing that with folks who had tested negative. And you can see, going back, describing who the cases and controls are. These are people who came in to get tested for any reason in California, and then they randomly selected 652 cases and then matched them to almost 1,200 controls. And they adjusted the models, as you can see, to account for vaccination status. And what you see is the most cases and controls are from the age groups of 18 to 64. So young adults to middle-aged adults. Again, those are the ones that we most commonly test. Not surprising, you can see a pretty wide geographic variation across California, pretty good ethnic diversity as well. And then vaccination status, you can see that a minority were fully vaccinated, even among the controls. And then the reason for getting tested, obviously, most of the people who were positive, not surprisingly, presented for symptoms, and a larger proportion of people who were in the control or test negative, 43% were the result of routine screening. So obviously, again, as in any test negative design, there are some inherent differences in the populations that you have to think about. So that the folks who are in the negative control cohort, less likely to have symptoms, more likely to be screened routinely from a workplace or school. However, what they found is a significant difference in mask wearing between those who tested positive and those who tested negative. And just based on that, you could think of potential opportunities for bias that would affect that, including the fact that more negative controls were from places like workplaces and schools that had implemented institution-wide testing regimens, so more likely that they would also have a mask mandate in place. But what is difficult to think of how those types of biases would affect was the type of mask and the effect that seemed to have on the overall odds. So you can see that there was, a pretty good, what we would call for other exposure epidemiological studies, a dose response effect, where the better the mask, the better the filtering efficiency, the lower your odds were of ending up with a positive test, and a pretty significant trend. So you can see that the adjusted odds for wearing a cloth mask were 0.44. That went down to 0.34 for a surgical mask and down to 0.17 for a KN95 or an N95. Now, that trend is really meaningful because it's pretty hard to think of how those biases would affect those different types of masks differently. But it's easy to assume that the better the filtering efficiency, the better protection you're getting from that mask. But the one lesson to note, and again, this is just odds for an individual, so it's primarily what are the odds that the wearer is protected. And those odds for even a cloth mask are pretty low. And when you multiply that across an entire population and think about source control and those phenomenon that we've talked about before, that it's not necessarily what happens in the first transmission event, it's how does it affect the total 5-6 generations down the line, you can see that even cloth masks would have a pretty significant disease mitigation effect as you get down the line in terms of population mitigation. But looking back 14 days for individual risks, you can see that there's a huge difference between folks who wore masks and who didn't, and an even bigger difference if you wore a mask with better filtering efficiency. So this was a graphic that the article put in place just to kind of capture the summary of what the data showed. And again, showed that even for cloth masks, there's a significantly reduced risk or odds of being COVID positive. And that got much greater as you went in increasing filtering efficiency to surgical mask and respirators. So again, another study adding to the overwhelming mountain of evidence that face masks work. But apparently schools are magical places where the laws of physics and aerosol dynamics and filtration efficiency of masks don't count, even though it's the highest density of places that we put any people in our communities. And again, what we're going to end up with is this let her rip strategy, which is how we've approached mostly the Delta and Omicron waves. And you can see where that's ended up. First of all, we still have a pathetic strategy for increasing boosting among US citizens. And while we started out very good in the summer, you can see we've lagged well behind most Western countries in our rate of boosting. And we have far exceeded their accumulation of deaths over the course of the Omicron wave and going back even into the Delta wave. And if you look at the course of the last several months, you can see that two of the countries that have had the most liberal approaches to non-pharmaceutical interventions and are mostly letting it rip are the UK and the US. And we've, far exceeded the UK in terms of our COVID deaths really over the last 8 to 10 months, right? So we were well behind the UK in the spring of 2021. We have surpassed them and are growing at a greater rate. But you can look at other countries, Germany and Canada, which adopted much more targeted non-pharmaceutical interventions, also have done a better job at boosting, have not had the dramatic rise in deaths. And then countries that we've pointed to all along that have done a great job in implementing intelligent non-pharmaceutical interventions without lockdowns. Japan and South Korea have done still incredibly well in terms of their number of deaths per capita from COVID. Now, of course, kids are different, right? As we all know, kids don't get COVID and kids don't die of COVID. And flu is a much bigger threat to kids than COVID is, if you believe much of what's in the popular press. Now, when you actually go back and look at numbers, that completely contradicts all of what's in the popular press, but it's easier if you don't look at numbers. But let's do for just a minute and look at the worst flu season that we've had for pediatric deaths in our recorded history of flu seasons, and that was 2019, 2020, where we had 199 deaths from kids. And again, that topped the previously bad season of 188 pediatric deaths, right? So as we know, kids don't die of COVID more commonly than they die of flu, or do they? Just in the past 5 months. And to construct this data, Carter Metro had to go back into cached websites for the CDC and actually pull the data from each of these weeks to be able to tally the cumulative number of pediatric deaths. But if you look, in the middle of August, there were 457 pediatric deaths from COVID up until that time. And then in the beginning of February, there were 1,239. So over the last 5 months, since the school year opened for 2021-2022, we've experienced 60% of the total pediatric deaths for the entire pandemic, and almost 800 pediatric deaths in the last 5 months, again, compared to fewer than 200 for the worst flu season that we've had in recorded history. So clearly something's not adding up. And the let her rip strategy is not really working and not protecting our kids in schools, and certainly not protecting our communities from increased transmission. So in the spirit of the absurd, this is kind of how I feel watching how we're responding to what is, thankfully, finally the downtrend of the Omicron, but certainly not the end of the pandemic.